Hi, my name is Madelynn Smith, and I'm a part of the Anorexia Nervosa group. So after me, my group mates will speak as follows: Vanna Prom, Hailey Tran, Cherri Nelson-Owusu, and we'll end with Isabelle James. So what is anorexia nervosa? Well, according to the DSM-5 criteria, a person with anorexia often presents with this distortion of their body that leads them to think that they are overweight when in fact they're underweight. So, due to this fear of becoming fat, many people with anorexia nervosa will exhibit behaviors that prevent that weight gain. This can be anything from running extensively after a meal, tracking everything that goes into their body, making themselves throw up, and in some cases, the use of laxatives has been noted, although it's not always common. Now, as stated by Morgan 2020, the difference between anorexia nervosa and other eating disorders is the distinction between BMIs. While other eating disorders often are accompanied by BMIs that fall within the normal range or higher, anorexia nervosa specifically tends to be a BMI of less than 17. And due to this lack of body fat or insulation, many people with anorexia will often have trouble with regulating their body temperature. So you may see the presence of lanugo, which pretty much acts as an insulator to help compensate for this dysregulation. Other things to keep in mind is when anorexia progresses and becomes more severe, some females have been noted to experience amenorrhea, which is an absence of menstruation, which can lead to other underlying health issues. Now, it's important to note that although anorexia is more common within the early to late adolescent stages, it is not limited to that specific age group.
The stigma surrounding anorexia is a misunderstanding of the disorder. Individuals tend to minimize the recognition of anorexia nervosa and perceive that it's a lifestyle choice rather than a mental illness. The belief that anorexia nervosa is a mindset of eating more to overcome the condition is a dangerous stigma that can leave those diagnosed with anorexia with a feeling of hopelessness and depression. This belief includes the assumption that weight restoration alone signals recovery, which ignores the emotional and cognitive symptoms that persist even after physical health stabilizes and they do enter the normal BMI range. The media often portrays unrealistic body standards that glamorize these eating disorders, and this just contributes to the public's misconceptions and normalizes it. This also just reinforces the stereotype that people with anorexia are simply just trying to conform to those superficial beauty standards, which could be part of the problem, but there is just overall a lack of understanding that those suffering with anorexia nervosa are battling something much bigger, a complex psychiatric condition. There's also another belief that those with anorexia nervosa have a lack of willpower, they're attention seeking, and they just need to be in control. And this not only impacts how the public views individuals with anorexia nervosa, but also how those individuals view themselves. And this can just lead to shame and secrecy and reduce the chances of them seeking help when they need it. So overall, all of these stigmas hinder the empathy towards those diagnosed with anorexia nervosa.
To address the stigma, we can do a number of things. For one, we can try to normalize talking about eating disorders. According to Doglet, listening to personal stories from those in recovery has shown to help reduce stigma among students. It's a way of becoming comfortable with these sorts of conversations. This could help people separate the stereotypes they may have relating to anorexia by seeing people as a whole rather than just a diagnosis. We can also implement peer mentoring support programs and helplines. Peer mentoring support programs not only lead to more individuals accessing treatment, but also create a sense of belonging. Socializing with others who have gone through similar experiences reduces isolation, helping to release feelings of shame associated with anorexia. Helplines are a great source for those who think they or a loved one has an eating disorder. These can help address any stigma someone may have and encourage people to connect to resources. The Overeaters Anonymous and National Eating Disorders Association websites are great sources to get help.
In terms of addressing the stigma, one of the ways we can do so is by improving health literacy with awareness campaigns. According to DOCA Law, nationwide awareness campaigns may be useful to increase mental health awareness and literacy, as well as challenging the stigma surrounding these disorders. Another way we can do so is by publishing publicizing mental health recovery narratives. Stigmatization often leads to self-stigma, which makes people feel responsible for their conditions. This leads to negative emotions, causing people to not seek as much treatment either. When we publicize mental health recovery narratives, it is recommended that people begin to speak openly about anorexia nervosa, their experiences, and share their recovery stories, and to share with others that recovery is a very important part of the process.
Hello, I'm going to be going over evidence and scholarly sources. So our first article is a level 4 systematic review, and it pretty much goes over the leading barriers to care for people with anorexia nervosa. The number one leading barrier to care is stigma, and the second leading barrier to care is lack of social support. These kind of go hand in hand because if you have anorexia nervosa, you know that stigma is out there, so you're less likely to reach out for social support. But people are also less likely to give social support because of stigma. Our next article comes from the Journal of Eating Disorders, and it's the level 8 evidence. And it pretty much talks about how there's not enough emphasis on the psychological aspect of anorexia nervosa and too much emphasis also on the physical aspect. It mainly goes into the aspect that there's too much emphasis on the physical assessments, and there should be more psychological assessments, and the psychological side should be made known to ensure that people have full recovery, not just physically, but mentally as well. The next article is a level 4 systematic review, and it pretty much talks about how increased stigma decreases recovery from all eating disorders. It particularly decreases recovery in the mental aspects. It decreases help-seeking behavior and increases maintenance behavior of an eating disorder, and it also decreases physical recovery. Our last article is a level 7 scoping review, and it talks about two main misconceptions of anorexia nervosa. The first main misconception is that blaming person with a disorder for the disorder, and the second main misconception is that believing that recovery is not that difficult. Again, these kind of go hand in hand because someone's more likely to believe that recovery is not that difficult if they believe that if they blame the person with the disorder for the disorder. This article also goes into that men are most likely to stigmatize along with clinicians. So in order to destigmatize anorexia nervosa, these groups should be targeted.